this week on the recognition of long COVID. Tell me what you'll be asking of ministers.
Well, I'm very specifically looking at it from a DWP and work perspective. As a Scottish MP, health has obviously devolved, so I'm not looking so much at the health perspectives. As you rightly say, 1.3 million people have been diagnosed with long COVID, and there's a challenge there as we look to the PM's statement today on COVID and the potential risk to testing, is that we have people who contracted COVID during the first wave when mass testing wasn't available, and the actual definition of long COVID as it currently stands is that it cannot be attributed to anything other than COVID. But a lot of those people don't have actually a positive COVID test to back that up. Going forward, even mild cases of COVID can still cause long COVID and a number of symptoms. If people don't have a positive test, how can they then demonstrate that what they have is long COVID and get the appropriate support that they need?
Well, there's clearly a row going on within Cabinet about the cost of mass lateral flow testing, which we've all come to accept as a way of life, but it costs us £2 billion a month. The risk is clearly down. Is the government right to be moving away from mass lateral flow testing, in your view?
Well, you were talking about living with COVID, but the reality is we've been living with it for 2 years. And I think the test and trace, despite, as you would expect me as an opposition MP to have lots of issues about how the government has carried out that programme, but the testing and tracing, and importantly the self-isolation, has been part of that. Lateral flow testing gives people confidence, particularly if they're working in, for example, care homes or other settings, or visiting elderly relatives or those that are vulnerable. So I think we need to think very carefully about what removing that testing means for those groups and potentially the costs. I think the other thing to think about in terms of self-isolation is that people who are self-isolating, it's because we want to do the right thing and they want to prevent the spread. And potentially people who are in less secure employment, gig economy, zero-hour contracts, there could potentially be pressure on them to return to work too quickly, and then prevent that causes further spread of the illness. We've been very lucky with Omicron that it's not been as bad as feared, but there's nothing to suggest that there aren't other variants out there, potentially because from a global perspective, countries are not in as good a place as the UK in relation to its vaccine programmes.
The government says it wants to move to an attitude of personal responsibility rather than government diktat. That sounds like a position the Lib Dems should support. We can all take responsible decisions for our own benefit, can't we?
Well, interestingly, your reporter was out in Nottingham earlier, and I think people genuinely do feel quite torn. Yes, people want to do the right thing. People, to a large extent, absolutely have done. You know, the public have responded excellently to COVID generally. But I think these are some of the very foundational safeguards that the government has had in place. And I think we need to think very carefully about now whether now is the right time to be doing that.
The government have briefed this morning their sort of messaging, if not the detail, and they say people should not totally throw caution to the winds. They acknowledge that COVID remains a dangerous disease. It would be unfair to characterise them as just saying, go on, crack on, it's Freedom Day, you can do what you like. They are urging responsibility still.
Well, they're urging responsibility while taking some of those safeguards away that you would expect responsible people, such as taking lateral flow tests, to take. I mean, for example, when I go to Parliament, my expectation is that I test before I get on the estate, and I do that at least twice a week, because obviously I'm in a place where the virus could spread very quickly. So for me, there's a bit of it doesn't quite match up, that messaging about personal responsibility, but actually giving the people the tools in order to be able to do so.